I was right to go. Thanks very much. There are 16,764 cumulative confirmed cases of coronavirus in Victoria. That's 279 new cases since yesterday's update. I'm saddened to have to report that there have been now 309 deaths due to this global pandemic in our state. That's an increase of 16 since yesterday's report. Of course, our thoughts, prayers and best wishes are with the families of each of those people who have passed away. This will be a particularly difficult time for them. There are, in terms of a breakdown of those fatalities, 1 female and 2 males in their 70s, 2 females and 4 males in their 80s, 4 females and 3 males in their 90s. 11 of those 16 deaths are linked to aged care outbreaks. There are 662 Victorians in hospital. 40 of those are receiving intensive care and 29 of those 40 are on a ventilator. A total of 1,959,302 test results have been received, which is an increase of 21,566 since yesterday. Again, thank you so much to everyone coming forward, getting tested, to the lab technicians, to everyone who's working so hard to give us that critical data so that we can track and trace and limit the spread of this virus. It's such an important thing to do, and I'll come back to regional testing in a moment, but thank you for coming and getting tested, and please, even the most mild symptoms, please come forward and get tested. There's so little flu in our Victorian community this year because of a range of things, not least of which distance, hand hygiene, all of those restrictions and measures we've put in place. If you've got symptoms, cold or flu-like symptoms, there's every chance you've got this virus. And the best and most important thing for you to do is to come forward immediately as soon as those symptoms begin. Don't wait 2 or 3 days. That can be when you are most infectious. Come and get tested. We'll process your result as quickly as we possibly can. There's payments there of $450 if it means that isolating at home waiting for your result would mean you are out of pocket. It's a really powerful and important thing that you can do and you must do if we're all to get to the other side of this. There are 3,478 cases with an unknown source, so mystery cases, 95 since yesterday's report. As I think we're all coming to understand, that's not necessarily linear. It's not from yesterday's data, it's since yesterday, so that coronavirus detective work can take quite some time, but that's our latest addition to those mystery cases. There are 1,164 health workers who are active cases, and we send our best wishes to them. We thank them for their courage and care, their compassion, and we again reconfirm our gratitude to them and our commitment to them to do everything we possibly can to keep them safe. There's a big piece of detailed work being done in relation to a breakdown of health workers, where they've got it, the circumstances. As I've said a few times now, that will be a feature of the early part of next week. So if not tomorrow, then Tuesday, and we'll be able to go through that in more detail. There are 7,671 active cases across the whole state. We've had a few little data issues this morning around an exact number in aged care. As you can appreciate, we've got to not only get the results, but then attribute them to an aged care facility. But my advice, as of literally 10 minutes ago, top level, so not necessarily the exact number, but our experts estimate that there are 2,075 active cases in aged care. In terms of the regional metro split, there are about 451 cases in regional local government areas, those that are under stage 3, and just over 7,000 that are in metropolitan Melbourne under stage 4. Those numbers never quite reconcile because there's always a number of cases that are being investigated. I think the number of cases that are unknown and subject to further investigation is around 185. Just on regional testing, can I just again ask people in Geelong, Bendigo and Ballarat, one of the most important things you can do is to come forward and get tested. There are current sites, we've added to those sites, we've added extra staff. I think some of the opening hours have changed also to try and make it that little bit easier for people to come forward and get tested. We've got 158 active cases in Geelong, 49 active cases in Greater Bendigo, and 27 active cases in Ballarat. that is stabilising. We did see some growth. I think a couple of days ago we took you through that 14-day picture. It's really, really important that people in those communities, the greater community if you like, so not just the city itself, but some of those smaller communities that look to Ballarat and Bendigo and Geelong, to come forward, get tested. Really, really important. So if there's one ask as a kind of takeaway from today's briefing, if people in those regional cities, and indeed right across the state, but with a specific reference to those three regional cities, Greater Geelong, Greater Bendigo and the Ballarat region, if you can come forward and get tested, that is a really important part of us keeping the numbers in regional Victoria, which are low. We want to keep them low and drive them down even further. And I think these last few days have seen us go from about 512, I think was the number. I think that was the peak. And we're now, as I just said a moment ago, we are now down to about 451. So that's a really important thing that regional Victorians, particularly in those three big regional centres, can do. That's not to say that people in the Latrobe Valley or the Golden Valley or the North East or the far west of the state, all of us in regional Victoria, all of those in regional Victoria, if you've got symptoms, please come forward and get tested as soon as those symptoms begin, not 2-3 days later, and we'll do everything we can to get your test processed as fast as possible, and that'll give us the intelligence, that'll give us the information and data